But next, concentrating on family and schools, Mike Shooter.
Can you see us if we're sitting down here? That's okay, is it? Fine, okay. I still live in one of the South Wales valleys where I practiced as a child and adolescent psychiatrist. And that means that I see quite a lot of my ex-patients and their families. And I see the sort of people like teachers and social workers and so on who help me work with them. And I was walking along Abergavenny High Street a few months back, and a man came towards me and said, "You don't recognise me, do you?" And I said, "Well, I kind of do, but it's from a long time ago." He said, "Well, I was a social worker, and you were a psychiatrist, when we were both expert witnesses in the case of a girl called Sarah, a young woman called Sarah." I said, "Oh, I remember Sarah. Sarah was a drug addict and a heavy drinker, and she had recurrent severe depressive spells, and she was living with a whole variety of unfortunate men. She was unfortunate. They were fortunate to be with her, but unfortunately not very good. And she became pregnant, and she became severely depressed in the early months of her pregnancy. And this guy and I were both helping to take her baby, temporarily we hoped, into local authority care. God, I remember I said, yes, she had a full house, did Sarah. What happened to her? And he said, well, unfortunately she died a few years later of a drug overdose, whether by design or by accident. I said, what happened to the baby? And what happened to you? He said, well, actually, I'm now Director of Social Services in Gwent. And he said, you wouldn't believe this, but we have just taken that baby, who's now 20, just taken her first child into local authority care, because Sarah's baby grew up to be a drug addict and an alcoholic with a whole succession of poor relationships and so on. How can we break a vicious cycle like that? How can we turn mental and physical illness, ill-being, into mental and physical well-being in society? Well, that's what this report is about. And it begins, of course, with early intervention. Now, there are lots of explicit measures in these two chapters on early intervention, and I won't belabor them because you can read about them. The first, of course, is the essential perinatal services that we need. Sarah's problem, Sarah's baby's problem, didn't begin at birth, it began at the womb. And I've been banging on, only half facetiously, for decades about psychiatry of the fallopian tube. Well, here it is, yeah, here it is. What we need is comprehensive perinatal services for maternal and infant health, instead of the patchy, underfunded services that we've got at the moment. Secondly, of course, it's spotting things going wrong in early childhood. Every single child needs somebody close enough to them, somebody expert enough to spot vulnerability and to pour help in at that point in terms of individual help or family programs, family parenting programs. And schools. Schools. There's a plea in here for schools to have mental health on their curriculum, to have trained teachers trained in mental health issues and child development. When I was an SPR, we used to call it a specialist registrar in psychiatry, I spent a good deal of my time working on teacher training courses, teaching teachers about child development. All that went out of the window decades ago, but it's absolutely essential. Teachers in a prime position to spot things going wrong, to involve internal help, such as school counsellors, come back to those in a minute, and to draft in external help when things go really well. I would like to suggest something more than this, actually, that we need to change the whole ethos of schools. They're rapidly becoming cramming factories dedicated to ill health rather than mental well-being. Again, I must stop saying when I was a lad, but When I was a very junior medic, I practiced in East Anglia, and we had a system there called the village college, in which the school belonged to the whole community, and the kids who were in school had placements in creches and old people's groups and so on that went on at the same time as the school day and in the evening. It was about community well-being. Now, I've no idea what happened to that concept of the village college. I think it crawled as far as Leicestershire and died. But I think we should resurrect it. Schools are important. However, I think actually, apart from those explicit messages, the real importance in this document, especially in the early years, 2 chapters, is in the implicit messages that run through it. The first of which, of course, is money. We live in an age of austerity. Mental health services, as Sue Bailey sitting down there said in the last vestiges of the presidency of the college, is a car crash. Is a car crash, and it is in Wales where I work too. We're asking, for example, in perinatal psychiatry, for £50 million to be spent if we're going to improve things in an age of austerity. We're asking for family parenting programs that cost up to £1,500 per head, per child, if we're to improve things. What we have to persuade people, of course, is if you spend money now, then you'll save 5 or 6 times as much further down the line. The real reason for spending now, of course, is the human cost further down the line in terms of Sarah and her baby and so on. But the Treasury needs to know what the financial savings are, and it's about 5 or 6 times. Now, the problem with that is, of course, you can't say to schools, to education departments, or to social services, you spend all this money now, you'll reap 5 or 6 times the benefit further down the line, because it's probably going to be another system that reaps the benefit. It's going to be criminal justice or whatever. So that argues for a complete change of commissioning and provision. It has to be combined commissioning through health and wellbeing boards, for example. Commissioning combined services with all the services dedicated to working with children and families in their area, working together with pooled resources. And again, I've been banging on for years about pooled financial resources, not just workforce and work power. Then we might get somewhere. Instead of the sort of baton-passing individual silo services that spend most of their time criticising each other from the top of rival ivory towers and blaming each other when it goes wrong. That means a wholesale change in attitudes. It's not all about money, it's also about changes of attitudes and new ways of working. And that requires innovatory thinking. In my latter days in the South Wales Valley I was talking about, I worked in Blaenau Gwent. Blaenau Gwent has no money. It is the 2nd poorest area in Europe after Kosovo. And that means we had to think in innovatory ways of serving the child and adolescent population of our area. Now this document is shot through with really good examples of innovatory practice, but it needs disseminating and they need following and learning from each other. Including England, learning from Wales and Scotland. Wales, for example, has a magnificent school counselling service with a school counsellor in every single secondary school in Wales, and it's now being funded for extension into primary schools too. And yet when I talk down in Westminster about school counselling, it's like waving a red rag to a bull. You know, we have to think across borders. And the final thing I want to say is, because I think it's not specifically mentioned in here, but it is implicit, and that is we need to listen to the voice of children themselves. Wales, the whole of Wales's policies on children and adolescents are predicated on the UN Convention on the Rights of the Child. And the UN Convention on the Rights of the Child, as you well know, has as one of its prime rights the right of a child's voice to be heard, not only in their own treatment and their own wishes and their own lives, but also in the design of services to help them. And we ignore that voice at our peril. Children are remarkably strong creatures if we allow them to be, and we listen to them, and we take their advice. Which brings me to my final point, because I was sitting on windowsill out there with Sue and Woody and so on. And I was saying that one of the joys of working on really poor estates in Wales is that every now and again you find a family with just as big a set of disadvantages as Sarah and her family. Single parent mum, 3 or 4 kids, all with special needs of one sort or another, who are not only surviving but flourishing. And you wonder, why is that so? And it's about resilience. And thankfully we are now beginning to think in terms of resilience and well-being and how we inculcate that in our social capital. And that, of course, is the main message of this report and what gives me therapeutic optimism for the future. Thank you.